The timely diagnosis of myeloma is very important for patients, both for their short-term complications and indeed their long-term outcomes. We know that this isn't just a disease of numbers. Patients come in with the potential of end organ damage. And in fact, we have changed our diagnosis of myeloma to not wait until a patient has renal insufficiency or anemia or bone disease. We want to try and catch it in such a way that we can prevent those complications. We know that when there is a long delay in a patient's diagnosis, that is going to translate into inferior outcomes and more organ damage down the line. This fits in with our greater interception of malignancies in general, that we always want to catch them at a phase where we can prevent long-term consequences. And so ensuring that we initiate the right tests at the right time in patients that have signs and symptoms consistent with multiple myeloma will allow us to not only make a more timely diagnosis, but indeed to prevent some of those downstream complications that we can see when patients have bone disease, renal insufficiency, anemia, and other consequences that can significantly impact their quantity and quality of life. There was a time not long ago when I trained in myeloma that the average survival of patients was really only 1 to 2 years. Now we anticipate the majority of our patients will actually live more than 10 years with this disease. That improvement in survival has been the result of many things, including the novel therapies that we've introduced, but also a more timely diagnosis, where we no longer wait until a patient must have end organ damage, but that with the new slim crab criteria, we are catching patients prior to that end organ damage. So being at the forefront of this disease and capturing it before others can capture it becomes fundamental. The primary care world is really at the forefront of multiple myeloma in recognizing the early signs and symptoms of the disease, matching that with the right testing so that our patients can have a timely diagnosis, which will influence both their quality and quantity of life.